So we're going to be demonstrating the inserting of a nasogastric tube. So first, you're going to be checking the physician's order for insertion of the NG tube. You need to prepare your equipment. You're going to want to prepare tape and the nasal securement device, which we got tape and tape for the nose. You want an NG tube and lubricant.
NG tube, lube.
60 milliliter syringe and stethoscope.
Boom.
Disposable pad and towel, and an emesis basin. A cup of water with a straw. If the patient is to remain MPO, you can just have like an empty cup of water with the straw just to stimulate like a swallowing reflex as the tube is being inserted. You're going to want tissues for watering eyes, gloves, tape and safety pin to secure the tube to the gown. Our patient is naked though. He didn't want to wear a gown. Okay, so you can prepare the patient by confirming the correct patient ID and date of birth.
What's your name and date of birth?
Okay,
Cool.
so you're going to explain the procedure to the patient.
I'm going to be inserting an NG tube in you today. It's going to be a little uncomfortable. We're going down through the nose and into the stomach.
And now you're going to assist the patient to the high Fowler's position, which he is already in. Drape the chest with a disposable pad or a towel. And have an emesis basin on standby. You're going to first check the nares for patency by asking the patient to occlude one of the nostrils and breathe normally through the other. And you're going to be checking which nostril is basically most patent. And you're going to use that for
Use the right nostril.
Tube placement. Okay, so now you're going to measure the distance to insert the tube. We're going to place the tip of the tube at the tip of the patient's nose.
Just like I do on the other side.
Extend to the tip of the earlobe. And then down to the xiphoid process. And you're going to mark that area with tape. So at this point, you're going to put on your gloves. And now we're going to insert the tube. So you're going to start off by lubricating the tip of the tube with water-soluble lubricant. And you're going to ask the patient to hyperextend the neck. He's not very cooperative. Now insert the tube into the nostril while directing the tube downward and backward toward the ear of the same nostril. Once past a 90-degree bend, instruct the patient to tilt the head forward to a normal eating position. Gagging is typical at this moment. Encourage to swallow, even if no fluids are allowed for this patient, as it will stimulate the swallowing process and help the tube go down. You're going to insert the tube until the tape is reached. And as the patient is breathing or taking breaths, you're going to want to stop inserting so the patient has a moment to breathe. Okay, so the tape is reached. We are good to go, but we're going to discuss some problems that can arise during this process. If gagging is to occur, you're going to want to pause momentarily, encourage swallowing, and check for tube in the back of the throat. You might want a pen light for this, as it's a dark orifice for this fella. Another thing you want to check for is resistance as the tube is going down. If you feel resistance, you're going to want to try rotating or redirecting the angle of the tubing. You're not going to want to force this. If you're unable to advance, withdraw, relubricate, and insert in the other nostril. You're going to watch for some signs of distress, watch for gasping, cyanosis, or the patient's unable to speak or hum. If any of this occurs, you're going to want to withdraw the tube. So determining the placement of the tube, you're going to get a syringe and place 20 to 30 milliliters of air in in the syringe and insert into the tube. Simultaneously, you're going to be listening over the patient's epigastric area, listening for a swooshing sound to confirm that the tube is in the stomach. Another way to check, you're going to attach the syringe to the end of the tube, aspirate a small amount of gastric juices, and check the pH. If the pH is 6 to 7, that means that it is inserted into the lungs where we do not want it. You're going to want the pH to be somewhere around 0 to 4. That would indicate gastric acid, and you're in the stomach. So if the tubing is not correctly placed, you're going to advance 5 more centimeters and recheck this process. You're going to also replace the stomach contents unless there's blood present or the NG suction is planned, or NG suctioning is planned. So you're going to secure the tube with tape to the patient's face with the nasal tape. Next, you're going to secure the tube to the patient's gown by using tape and a safety pin at the shoulder level. But like we previously said, our patient is not wearing a gown. He prefers to go buck naked. So we're just going to show kind of how you would wrap that around the tube and apply a safety pin. And you pin that to his gown. Okay, so at this point you're going to wash your hands. Obviously take off your gloves first. Remove the equipment and make the patient comfortable. You're going to record the insertion procedure, the type and size of tubing, what nostril you used, that your placement was checked, description of the gastric contents, and the patient's response/assessment. You're going to be checking placement before all feedings, all med administrations, or at least once per shift, if not in use, and document placement is also checked every 4 hours, or whatever your hospital's policy is. And you're also going to do a daily assessment on the patient with an NG tube, just an abdominal assessment, looking for bowel sounds, and whether it's soft or firm, or if any distension. And that is the insertion of an NG tube.